previously healthy 2-year-old boy is brought to the emergency room by his mother because of persistent crying and refusal to move his right arm. The episode began 30 minutes ago after his mother lifted him up by the arms, and he appears distressed and is inconsolable. Vital signs are within normal limits. On examination, his right arm is held close to his body and flexed and pronated position. So, which of the following is the most likely diagnosis? Okay, so mhm. So that was this is a very classic scenario that comes in the question. So whenever there's a child who is playing with an elderly person, and it has got something to do with pulling their hands, like playing with lifting them with their pulled arms or swinging them on the stretched arms, then this is a very classical scenario which is the radial head subluxation. So there's a very common name that we use for that. The radial head subluxation, the common term, it's called the pulled elbow. Okay, so sometimes they can tell it's the pulled elbow as well. Okay, so this is a very classical scenario, and you can expect questions on this. So here the baby hold his arms in a very characteristic position, which is close to his body in a flexed and pronated position. So I'll give you a tip here. So hand is held in a pronated position. So for treatment, we do either supination of the arm or hyperpronation for to correct the dislocation. Okay, so that is very important here. And what is the proximal ulnar fracture called? Proximal ulnar fracture has a name. Polys is a radial head fracture, but yeah, it's the Monteggia fracture. It's called the Monteggia fracture. So I have a mnemonic for you to remember that. It's M-U-R-G, Murg, okay? So it says Monteggia, M is for the ulnar, up, okay? So it's proximal upper ulnar fracture. That's a proximal ulnar fracture is MU, Monteggia, ulnar, and upper. Okay, with radial head dislocation, and RG is for the radial, which is the Galeazzi's fracture. Yeah, so that's right. So that's a Galeazzi's fracture, which is the radius, and there is a distal radioulnar joint dislocation as well, which is a component. But here, the baby doesn't have any fracture because fracture, if it's a fracture, definitely they would have mentioned some signs of fracture, like there is swelling or there is some deformity would have been mentioned. So here the most appropriate answer is radial head subluxation. And yeah, so anterior shoulder dislocation also, how do you differentiate? So normally we see there's a shoulder droop in shoulder dislocation, and also most of the times we see that the arm is little externally rotated and little abducted from the body. Okay, so here it says that he is held close to the body in a flexed and pronated position. So if it was shoulder dislocation, they would say there's a shoulder droop, and then it could go a little bit away from the body. Fractures are mostly epilepsy related. Yeah, sometimes that scenario can come up because after a seizure episode, and if they have some pain or deformity in the limbs, that could suggest a fracture, because a lot of limb fractures happen like when a patient falls after a seizure in epilepsy. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.